And I'm pleased to have Dr. Darian Sutton, an emergency physician in New York City, here to break this all down for us. Dr. Sutton, good morning. It's always great to talk to you. You know, how big is this news from Pfizer today, and when do you think the general public can expect this vaccine?
Well, good morning. It's incredible news, actually, now that we have these efficacy rates reported by Pfizer and Moderna, which are both mRNA vaccines. It proves that there's possibly some major hope in the future of treatment for COVID-19 and, most importantly, prevention. As far as rollout and distribution, I think we probably won't see it until early next year or into early spring.
And let's talk about this CDC warning. We've heard in the past that because of the ventilation, risk on planes is low if everyone has a mask on. So why do we need to avoid traveling for the holidays?
Well, right now has never been more important to pay attention, be vigilant, and be mindful of the fact that now not only are we having this pandemic, but we're experiencing an incredible surge. As you stated earlier, we have the most amount of hospitalized patients we've ever, reaching over 80,000 most recently, compared to our prior surges in April and July, which were approximately 60,000. So now is an important time to pay attention and do every possible thing in order to mitigate the spread of this virus and also prevent hospitals from prevent hospitals from overcoming capacity.
And when they say don't celebrate with anyone outside your household, what if your household is just one or two people?
So that's the unfortunate case. You know, as a person who is also wanting to celebrate with my family, I have to realize that my household is separate from my parents' household and that of my grandparents. And so it really is not a great time to combine households. And what we're trying to advise people is that try as best you can to mitigate these factors and separate. I really would advise for people not to be involved in indoor gatherings with closed ventilation with multiple households, because this increases the risk of spread. And as someone astutely said before, this is an important time to pay attention. It's better to have a Zoom Thanksgiving than to have a conference from the hospital or New Year's.
And we've been seeing more restrictions like curfews in place. How does that help? Why does it matter if someone's at a restaurant at 9 p.m. versus 11 p.m.?
So this becomes a sticky part. I have to say that I personally disagree with establishing curfews. I think when rules are given out in order to serve as mitigation factors, we have to be direct, identify those places that are high risk in counties and states that are high risk, and making sure that we close those areas and curtail the amount of people habitating those areas. But as far as a curfew, I personally think that it can lead to more people distrusting the system because it's not understood easily. And like someone importantly said, this virus is not a vampire. It doesn't just attack at night. To be honest with you, most of these outbreaks are occurring during the day. And my fear is that if we establish a curfew, we'll have people surging in the evenings trying to beat that curfew, and that can lead to more spread.
An ongoing discussion on that for sure. New York, which I know is where you work as well, it's where I live, you know, it was hard hit by the virus in the spring. Now we're seeing positivity rates creeping back up. Are you worried about a repeat?
Absolutely. I have to say that as I worked in New York during the height of this pandemic, I saw what it looked like when hospitals reach capacity. And when you run out of room, inevitably mortality increases. So what we're trying to say in these states like California and New York, that although are not suffering the highest rates of COVID-19, they are most densely populated, so most at risk for exponential growth. So right now, we have to take every mitigation effort possible to prevent that.
And I got a viewer question on Twitter that I wanted to address with you. This person's asking if it's true that if you have COVID, you can be listed as a COVID death, even if you died of something else. Now, this is a commonly heard misconception. So can you explain how it really works?
Yeah, this is an actually important question to answer because I hear it often. What people have to understand is that when you are admitted to the hospital, oftentimes, more often than not, patients have other comorbid issues such as hypertension and diabetes. And unfortunately, if that person were to die, their inevitable death will have listed as COVID as a diagnosis, but also listing contributing factors like their comorbid issues of hypertension and diabetes. Also important to know that COVID can create additional comorbid issues like respiratory failure and renal failure during the hospitalization. So to the person who may not be equipped to understand the complexity of a hospital course, it can look like someone has died of other issues other than COVID, but this is not to be confused. If someone is admitted for COVID-19 and during that hospitalization they die, it is inevitably due to their initial cause, which more often than not is COVID-19.
And so they would not have died had they not contracted COVID-19. Is that the idea?
That's the exact idea.
All right, Dr. Darian Sutton, it's always great to have you. Thanks so much for joining us today.
You too. Have a great day.
You too.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.